neurologic system and learn how to examine the motor system and reflexes. With the healthy person shown here, you'll see normal findings. In your practice, you may see the same findings, normal variations, or abnormal findings.
Before examining the motor system and reflexes, consider the relevant anatomy. The central nervous system has three major motor pathways, or tracts. The corticospinal, or pyramidal tract, contains motor nerve fibers that originate in the motor cortex, travel to the brainstem, cross to the opposite side, and pass down the spinal cord. It controls highly skilled voluntary movements such as writing. The extrapyramidal tract includes all of the motor nerve fibers in the central nervous system that are outside the pyramidal tract. These fibers maintain muscle tone and control automatic body movements such as walking. The cerebellar system coordinates unconscious movement, maintains equilibrium, and helps maintain posture. The cerebellum integrates motor information and uses feedback pathways to control the cortex or lower motor neurons in the spinal cord. Reflexes allow rapid reactions via a reflex arc. In the simplest reflex arc, sensory neurons carry the message from the receptor through the dorsal root and into the spinal cord. There they synapse with motor neurons. From the ventral root, motor neurons carry the message to the muscle, which produces the reflex. If the person seems well and has no significant history, perform a screening neurologic examination. If he reports neurologic concerns or shows signs of neurologic dysfunction, perform a complete neurologic examination, which will be shown.
I had an uncle who had a stroke. He was only 50.
Keep in mind that the incidence of stroke is 2.5 times higher in blacks than in whites, and the incidence of multiple sclerosis is higher among whites. Yet both disorders affect the motor system.
Okay, Mr. Gambrell, I need for you to have a seat at the table for me.
Sure. For the motor system examination, begin by assessing the muscles. Inspect all muscle groups for size, comparing one side with the other. Muscle groups should have no atrophy, be symmetrical bilaterally, and be within normal limits for the person's age.
Now I'm going to test the strength in your arms. Okay? Could you lift your arms up for me? Good. And try to...
As you would during a musculoskeletal examination, test the strength of homologous muscles simultaneously.
Test the strength in your shoulders. All right. I need for you to shrug your
The person should be able to overcome your resistance.
Good. Now I'm going to assess your muscles. I need for your arms to go limp like a rag doll.
Next, test muscle tone, the normal degree of tension in voluntarily relaxed muscles. To do this, first persuade the person to relax completely. Then, move each extremity smoothly through a full range of motion, providing support at the elbow or knee. Normally, you will note a mild, even resistance to movement. As you assess the muscles, you should see no involuntary movements. If they are present, note their location, frequency, rate, amplitude, and ability to be controlled at will.
Now I'm going to put you down up, and then I'm going to ask you to stand.
All right. To assess cerebellar function, begin by assessing the person's balance. To do this, observe his gait as he walks 10 to 20 feet, turns, and comes back. Normally, his gait is smooth, rhythmic, and effortless. His opposing arm swing is coordinated, and his step length is about 15 inches.
Now I need for you to walk to the wall, heel to toe.
All right. Also, ask the person to walk a straight line in a heel-to-toe fashion. This tandem walking accentuates any coordination problems. Normally, he can walk straight and stay balanced. In an older adult, the gait may be slower and more deliberate and may deviate from a midline path.
What we're going to do now is we're going to check your balance.
To further assess balance, perform the Romberg test. While standing close to the person, ask him to stand with his feet together and his arms at his sides. Then have him close his eyes and hold this position for 20 seconds. Normally, he can maintain his posture and balance, but may sway slightly.
Okay, you can open your eyes.
As a final balance test, ask the person to do a shallow knee bend or hop in place, first on one leg, then on the other. This demonstrates normal position sense, muscle strength, and cerebellar function.
Now I need you to have a seat on the table.
To further assess cerebellar function, evaluate coordination and skilled movements. Test rapid alternating movements by asking the person to pat his knees with both hands, lift up, turn his hands over, and pat his knees with the backs of his hands.
Okay, fast.
Then ask him to do it faster. The movements should be done with equal turning and a quick rhythmic pace.
Now I need for you to touch.
Or ask the person to touch his thumb to each finger on the same hand, starting with the index finger, and then reverse direction.
Now with the opposite hand.
Normally, this can be done quickly and accurately.
Good. Now
Ask the person to perform the finger-to-finger test. With his eyes open, ask him to use his index finger to touch your finger, then his nose. After a few times, move your finger to a different spot. His movements should be smooth and accurate. Also, have the person do the finger-to-nose test. With his eyes closed and his arms outstretched, ask him to touch the tip of his nose with each index finger.
Now you try.
Alternating hands and increasing speed. Normally, this is done with accurate and smooth movements.
Good. Now you can open your eyes.
With the person supine, do the heel to shin test. To do this, ask him to place his heel on the opposite knee and move it down the shin from the knee to the ankle.
Excellent. And do the same thing with your right heel.
Normally, he can move his heel in a straight line down the shin.
Good. Now what I need for you to do is to sit up, okay?
For the reflex examination, start by testing the deep tendon reflexes, or DTRs. To elicit and grade reflexes properly, remember these guidelines. Relax the limb and partially stretch the muscle. Use the hammer's pointed end for small targets and the flat end for large targets. Relax your hold on the hammer. Strike a short, snappy blow to the muscle's insertion tendon. Do not let the hammer rest on the tendon. Compare the right and left sides, which should have equal responses.
Okay, what I need for you to do is relax for me.
If the reflex does not appear, encourage further relaxation. Vary the person's position, or increase the strength of the blow.
Okay, what I need for you to do now is take your hands, put them together, and kind of pull.
Also, try reinforcement by having the person perform an isometric exercise in a muscle group somewhat away from the one being tested. After you elicit a reflex, grade it at 4+ for a very brisk hyperactive response with clonus, 3+ for a brisker than average response, 2+ for an average or normal response, 1+ for a diminished or low normal response, or 0 for no response.
I'm going to test the reflexes in your legs, so just relax your legs for me.
When grading reflexes, remember that an older adult normally may have decreased deep tendon reflexes and may have no Achilles reflex.
I'm going to check your reflexes.
Begin reflex testing in the arms with the biceps reflex. Relax the person's forearm by supporting it on yours. Then place your thumb on the biceps tendon and strike it. The normal response is forearm flexion. Next, test the triceps. triceps reflex.
Okay, I'm gonna check your triceps now. I need you to relax your arm, let it dangle a little.
To do this, hold the person's relaxed upper arm. Then strike the triceps tendon just above the elbow.
Okay.
The normal response is forearm extension.
Okay, relax your arm for me. Just kind of let it dangle, as if it was going limp. Okay. I'm going to check your triceps reflex.
Alternatively, hold the person's wrist across his chest to flex the arm. Then tap the tendon.
Relax for me.
Move on to test the brachioradialis reflex. While holding the person's thumb to suspend and relax the forearm, strike the arm about 2 to 3 centimeters above the radial styloid process. The normal response is forearm flexion and supination.
Good. Just relax. Now we're going to check the reflex.
Perform reflex testing in the legs, starting with the quadriceps reflex. With the person's lower legs dangling freely, strike the tendon just below the patella. This should elicit lower leg extension and palpable quadriceps contraction.
Good. I'm going to check the reflex.
For a supine person, use your arm to support the weight of one leg against the other leg and flex the knee. With this position, you can't feel the quadriceps contraction, but should see lower leg extension. Next, test the Achilles reflex. With the person's knee flexed and his hip externally rotated, hold his foot in dorsiflexion and strike his Achilles tendon. His foot should plantar flex against your hand. If the person is supine, flex one knee and support that lower leg against the other leg so that it falls open. Dorsiflex the foot and tap the tendon.
Good. Now I'm going to check your ankle just one more time.
If the person's reflexes are hyperactive, test for clonus. Support his lower leg with one hand. Briskly dorsiflex his foot with your other hand and hold that stretched position. You should feel no clonus, which is rapid rhythmic contractions in the foot and calf.
Okay. Relax. I'm going to check your stomach reflexes.
Okay.
I'm going to place this pillow underneath your knees.
When testing the superficial reflexes, begin with the abdominal reflex. With the supine person's knees slightly bent, use the handle of the reflex hammer to stroke the abdomen toward the midline over the upper and lower quadrants. In response, the abdominal muscles display ipsilateral contraction, and the umbilicus points toward the stroke.